the menopause here? Oh,
Oh yeah. All right. So let's see if it says it's setting up the meeting, redirecting, and it should be live now.
hi, we're there.
Hi, we're here.
Yeah, I
So
can
now
see.
I am trying. Oh,
It's frozen. There we go. We're all live now. Hi, people.
okay.
We're live. There we go. Okay.
Yay. All right. So I should
Hi,
be able to see any
everybody.
comments. We are here with, oh, say your name because I don't know how to say the last name. I know you just keep saying FitzD, but you say your last name.
Hi, I'm Rachel Fitz-Desorgher, but that's impossible. So everybody knows me
Possible.
professionally. Professionally, I'm known as Rachel FitzD, and it's my own fault because Desorgher is actually my name, and Fitz is my
Oh,
husband's pre-married name, and I was not going to give up my name, Desorgher. So we both slapped them together. And now he gets the worst end of the bargain because he's gone from being Fitz to being Fitz-Desorgher, whereas I just had to pop on Fitz at the beginning. But yeah, Rachel FitzD it is. There we go.
awesome. And of course, I'm Zia McKinney, and I am, we are live because um, I Rachel and I had a really fun conversation I don't know, months ago. But back in 2024, it was before the holidays and everything. And we enjoyed chatting with each other and lots of information and very interesting the differences between um what a standard venue for a birth is in the UK versus a standard venue for a birth in America is very different. And we'll definitely end up talking about that. And so, uh, yeah. But part of the reason that we're chatting, it's just not about birthy stuff, is that Rachel and their family also has EDS, HEDS.
Well, we think we may have a bit of a crossover, maybe a little bit of a mosaic, because although we've obviously got hEDS really throughout, and even my relatives abroad, my sort of more distant family, cousins, and so on and so forth, and beyond. There are quite a number of features that sit far more in the classic area, but that's quite typical, as people on here will know. There's such an overlap, a sort of sliding scale. And one of my boys in particular looks far more sort of classic, whilst having all the elements of the HEDS as well. Yeah.
Yeah. Yeah, we have a similar that um there's a rarer type that I meet a lot of the criteria to, but there hasn't been a lot of collecting of the DNA data for that one yet. So that's sort of on hold for a further diagnosis until they accumulate the data. There's just isn't any data.
Well,
And
science is a constantly growing field, and this is what is so
yeah,
beautiful, really, about science. It is a beautiful discipline because, of course, it's always on best available evidence. People sort of can get a bit squeaky about the scientific method, but of course, we're always looking at the best available
yeah,
evidence. And as we gather more data, things change, and sometimes, you change back. Things go in circles, and that's because as we gather more data, so our knowledge expands, changes. I say sometimes it feels like it's going full circle. But of course, bit by bit, as we get to know more about not only genetics, but epigenetics, which is, of course, is all about which genes that we have inherited actually get switched on and express themselves. Because not all the genes that we have within us are switched on to be expressing themselves, and that's epigenetics. So who knows?
yeah. There's so much research. I attend the Ehlers-Danlos Society EDS Genetics and Genomics Echo. I've taken all the echoes. I'm like obsessed with the echoes, and just listening to how they're collecting the data is fascinating to me. And my daughter attends them when she's home because that's the part of the field she wants to go into is doing research about that. And so we've been fascinated by the genetics aspect of it. And everybody's like, no, you just get a genetic test and it's cut and dry and that's it. And listening to them talk about like, how they read the data and, what's a variant of, unknown significance literally means they just don't, like, nobody has put it in the database yet, basically. And it's I guess it's reassuring to know that we are, like you said, just on the threshold of learning about how we're going to classify. People are like you said, like, well, I fit under the hypermobile umbrella, but I also fit. And so I think it's just going to be that we keep like finding another genetic expression, and then that's going to turn into, another kind, and then we're going to find and that so that hEDS is going to keep getting carved
I know.
out.
Well, I can imagine for you. Yeah, well, and the edges are, I say the edges are moving all along the spectrum. It is such a broad spectrum, from, people who, like my husband, you say, touch, can you touch the ground with, can you bend over and touch the ground? He can barely reach his knees.
Yeah.
Way through. And then, of course, paradoxically, we go through the EDS, the other connective tissues, and then Lois Dietz, and then up to Marfan's. And paradoxically, at the far end of that scale, of course, we've actually got osteogenesis and brittle bone disease, osteogenesis, which always seems such a paradox to have brittle bone disease sort of right up that bendy spectrum. But this is why I say things almost come full circle. It's a fascinating area of study and science and research. It really is. So there we go.
Yeah,
Anyway,
my daughter's one of her besties. We've been family friends with their family for decades. They have now been diagnosed with osteogenesis imperfecta and EDS and number of other things. And but bone's just another connective tissue. So if it can go wrong, it
there
can
you go.
go wrong. Oh yeah, it's a yeah, fascinating but scary how one little thing can get switched. And it's amazing that we all walk around upright
I know.
so for the
Human beings are
majority
so.
of the time.
Yeah, I certainly see that as
Um,
a midwife. I definitely see, uh, yeah, just how amazing and complex and brilliant the human body, well, all living creatures, but my speciality, of course, yeah, the human body and the human baby, and it never stops being completely mind-blowing, really, and very inspirational to see, yeah, how we're all put together with all our
right.
faults and glories.
So how did you find out? It sounds like it's pretty widespread in your family.
Yes. Yeah,
How did y'all figure this out?
well, that's a really good question, and there'll be other people in your community who are, I think, fortunate like me in that I grew up constantly being told sort of not to make a fuss because that's what everyone's like. Don't fuss about your weird heart rate and things because I'd say no to it and be like, and my mum would say, for God's sake, Rachel, everyone's like, my whole family had such disorganized sleep. And it just was normal. My mum was very affected, and well, I'm like her, not she's like me. We have a lot of the Marfan skeletal things. So I've got pectus excavatum, so my sternum goes right in. She had a mitral valve prolapse, and when they went in to repair her mitral valve, her sternum had not only sort of pushed her heart over to one side, but there were marks from all her ribs carved into her heart because of this she lived to be 79. You know, the
Wow.
is amazing. And yeah, so pectus excavatum and other sort of skeletal things she had going on, like me, and you know, very big feet and hands for our height and things. Weirdly long arms. So I kind of grew up just constantly being told to get on with things. And of course, also we were of an age where you did just get chucked out into the streets. And when you sort of fell over and hurt things, I was the fourth of five kids here. You know, I spent half my life in A&E, just getting strapped up in various ways and nobody paying me very great attention, which actually I think is a good
Oh,
it's a great thing because half the problem I see nowadays is, you know, obviously, you know, you know that I'm a specialist. Well, my background is as a specialist midwife, but also as a trained parenting consultant. And I've done parenting consultancy alongside my midwifery for over 30 years. And one of the biggest problems I see now is that parents are terrified of their children and can't bear the thought that their children might suffer in any way. And what's happening now is that they're making children frightened of their own shadow rather than, you know, I was lucky. I was swimming from birth. I've swum all my life, and my physio has said to me on many occasions, thank goodness that you were never wrapped in cotton wool, because she said that's what's keeping you out of a wheelchair. You know, you are so grossly hypermobile that had you not been so strong and conditioned with your family from such a tender age, you know, you would be struggling to mobilize at all. So the way that I found out the sort of diagnosis is that I was off work, bedridden actually. I'd had a terrible flare. The first and I don't know whether it was the worst one, but the first one often feels like the worst, doesn't it? Because you don't know what the hell's going on. And I was in bed because, of course, I'd been told to rest. As long as you rest, you know, that old fibromyalgia thing, you know, of oh, rest and pace, which is, you know, can be an absolute nightmare for some of us with hEDS because we don't keep conditioned on a daily basis. So I was getting worse and worse on my bed rest and Googling because there was Google by then, and actually came across something called mitral valve prolapse syndrome. And if you Google it now, you won't find it because, of course, that's been subsumed into EDS. And you know, like when it feels like someone has suddenly opened all the windows and you get a cold blast and it was a bit like that because it sort of
yes.
my mum,
Same.
the marfanoid habitus, all of these things, mitral valve prolapse. And I went to my GP. I sort of hauled myself out of bed. I was being tested for bone cancer because I didn't know what the hell was going on. So I went to my GP and said, I think that I need to be referred to London to see Professor Rodney Graham, who is the UK, I think he's just about retired. I think he's in his 90s, but the UK specialist. I want to be referred. I know with my midwifery head on, I had no problem at all in going to see my GP and say, this is what I want, this is where you go, this is the number you ring, this is who you write to. Because I think that we have mitral valve prolapse, Ehlers-Danlos syndrome, something and that. And he asked me lots of questions. He said, you're absolutely right. As it happened, he said, I went to a specialist seminar just this week.
Oh, wow.
And it was like, oh my God, I was so lucky. So I went along, my mother
Yeah.
went, we went along together, and they sort of diagnosed my boys by proxy because I said, look, you know, there's this and there's that and there's the other and all
Yeah.
sorts of things that just kind of didn't make sense. Really odd things that I realized as a midwife were, you know, not normal.
Right.
Um, yeah, they sort of went tick, 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 tick. So that's how I came to know about EDS and about my own diagnosis.
And
And
about
then,
how old were you when that happened?
well, I've got four sons. And I had gone back to work. So my youngest one must have been at least six, and I had him when I would think I was about 30. We had my kids. I had my first one at 24, and I think that I must have had Connor when I was about 31, 32, something like that. And it would have been after I'd gone back to work. So it would have been mid to late 30s, I
Okay.
think. And I am
Okay.
I'm 63 now. So, yeah, I guess I must have had my diagnosis, you know, a few decades ago, a couple at least decades ago. And I made it was great in some ways because it helped make sense of you.
Yeah.
I think I was smart enough to realize that you can't change your genetics. And being a midwife, I knew that you cannot expect everybody to know about everything. You cannot expect your midwives and your GP to know everything about everything. It's unreasonable. And so you have to be your own advocate, you have to be your own specialist. And also, I learned through my flares and through being a very active child to not be hyper vigilant about my body. And, so I was very quickly able to put good strategies in place to manage my pain. And very quickly, I had gathered so many orthotics, ones that I had all limbs at some point in these massive orthotics where you'd lock into so that I couldn't hyperextend, and using
Hmm.
all sorts, but they tear your skin. And was able to use CBT and being careful not to become hypervigilant about certain pains and certain injuries. That now I still occasionally have to tape things, and of course, just sometimes you'll see me here and I've got splints on because I've got various injuries and things. But yeah, I get on with things pretty well, and still swim and hike and do ballroom dancing with my husband. I play badminton and keep very fit and active, and yeah, do very well really. So
Yeah. Yeah, you're really lucky. I was lucky that I found belly dance early after I spent years trying to find an exercise that didn't cause me more pain, way before I ever knew anything. But all the exercises like made me worse instead of making me
oh
feel
yeah,
better. I just kept trying because I was a very active kid. We were free range 80s kids, like you just got let go. Um, and but things kept damaging me and hurting, so I just kept trying to find, I have to like, there has to be some sort of exercise that doesn't
yeah.
hurt me, and I just happened across belly dances, just one, I'm just ticking off all the boxes trying to find something. And I count myself because I was definitely going down the road of getting more and more damage points
Yeah.
without having a way to strengthen my joints, right? So I didn't have that balance thing. And so I feel very lucky that I had found belly dance when I did
Yeah.
to be
And
able
of
to
course,
strengthen my joints.
so many of us do dance. Now, I think you may know, and some of your community as well, particularly those in the belly dance community, will know my sister. My sister's has been a professional belly dancer for decades. She's a little older than me, Charlotte Desorgo, and she is not as affected as she's not really as hypermobile, and she's not as affected in other ways. With she's not so potsy and things as I am. But she's danced all her life. She has picked up lots of injuries. She's just got two replacement knees and things now. So that there are. But I
Yeah,
feel it's still better to stay conditioned. It's still better to, just
yeah,
accept the fact that you will injure, to know how to manage your injuries, to know I am a very, 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 I'm a very good swimmer, a really seriously good swimmer, but I am unbelievably careful. And sometimes when I get out the pool, people will say, "You're an incredibly tidy swimmer." What they mean, of course, that I haven't splashed them all, but I've had to learn to swim very carefully. And when I do ballroom dancing with my husband, of course, I've got him to sort of support me, but I have to just take special care, so I don't roll my ankles and things. And badminton, I have to say, I've hardly gone along this year because I just keep on picking up injuries. But that won't stop me going back again. I will get back. I will recondition my badminton muscles. There are just some things that we can't do. And I was stupid enough. My physio went mad because I decided to take up golf. And I think I went down the golf course once and she said, "But you're having a heavy, a heavy bit of metal on the end of your arm and
mm,
you're going to swing it." Oh my days, I injured myself so badly. So she said, "Don't ever do golf." So I have a strict list of what I can do, but never golf.
I had a garden tool injury. We live in Stone Mountain, and it's literally like my yard is made of stone. And so every hole I dig, I'm pulling out big stones. So I have this big mattock, and I wasn't taught how to use it properly. And so it gave me an impact injury because I was hitting and I didn't know to release so when you do it, you're supposed to release off a little bit when it hits so that it's not reverberating up.
Yeah, I bet
Like
you've got a fight on.
right, everybody's supposed to do that, right? Not just somebody with EDS, but I had never been taught proper. And so I ended up with my right hand just not functioning for 6 months.
Oh, I bet.
And it was, yeah, just like accumulating all of these weird injuries. And I'm a professional dancer, supposed to be playing finger cymbals, and all of a
Yes, yes,
sudden, you know, life, we're like, okay, we're shifting and change, right? So yeah, the accumulation, and I also fear the accumulation of injuries because I do decondition very quickly. I have to work daily at dance still,
yeah,
even though I'm not performing professionally,
yeah,
because I have to sort of change everything up and be meticulous in order to keep developing muscle strength. And when I had long COVID, when I was seriously ill for about 3 years, um, I that balance of trying to get well and reduce the inflammation, because when you exercise, part of what your exercise is that you cause some inflammation in your muscle builds, right? Like that's sort of a part of the physical process. And I was trying to reduce my inflammation. Man, I hope, yeah, it's that deconditioning thing is a scary
yeah. And
world when it's literally my muscles that are keeping my shoulders together, you know?
yeah, I saw my mum, she sadly died before she was able to get rehabilitated. She was meant to be going as an inpatient for 6 weeks to get some rehabilitation because I'd seen her become with older age deconditioned, and then the more deconditioned she became, the more symptomatic she became, and the more potsy she
Yeah.
became, of course, and the more frightened she became, and the more deconditioned she became. And yeah, just spiraling downwards. And of course, you have to reverse that. So yeah,
Yeah.
there we go.
It's a lot of work. We got to live in this for the rest of our lives.
Yeah,
And
gotta
it's
use,
so much
use
more
it or
work
lose.
for us, you know?
It is, but
It's a,
I see it as a benefit really because we have a better motivation than other people. It is essential. It is essential for me to keep as lightweight as I can and as fit as I can. And I count myself as really fortunate that it's more than just a sort of hobby or a sort of lifestyle choice, if you like. Keeping conditioned and fit and healthy is vital for me. And so, as I say, I actually see that as a real benefit because there is that daily kick up the bum to keep myself as fit as I can. Whereas some people, they've got lots and lots and lots of excuses. It just won't matter so much if they don't keep themselves fit and well. Whereas for you and I, we can quickly spiral into terrible pain and debilitation. And so we keep ourselves fit and well. So.
yeah, my daughter, it's funny you say that because my daughter, who's fascinated by genetics, who was taking a genetics course. And so we were having this discussion of, they had the philosophical discussion that day of whether if you could, genetically, re-engineer yourself to get rid of, your disability. Would you make that choice for yourself? Would you make that choice for, proceeding down when you're passing down your genetic line? And she's like, EDS has given a lot to us. You found belly dance, which is like part of our, community that supports us, and it's fun, and and it's a exploration of a different culture that's a deep dive that we wouldn't have necessarily gotten involved with, and lovely people and everything. And she's like, it forces us to eat well and learn how to cook in a way that we necessarily wouldn't be
That's
making all of those
I,
good choices all the time. And she's like, and we end up spending a lot of time together because you can't be off at a corporate job or something, so we've ended up spending more time together than she thinks, than what she saw her friends' families being like and stuff. And she's like, she's like, all the good things that I can think of in my life, EDS has given me.
Right.
And she's like, I don't like the other parts, like she has an ankle injury that we still haven't been able to get her body to recover from. And, all of these things. We're going to a orthopedist again on Thursday, right? Like, but I thought that was, she was like, I don't know, 15 or something when she was talking about that. Oh, it was pretty mature way of looking at it, at assessing her, you know, what checking off the good parts. Not all teenagers would look
Yeah.
at life that way,
Right.
you
No,
know?
I think it pays to, there are some days when we can't look at the positives, but whenever we can, I think it really pays to, yeah, be grateful for what we have and also how some of our genetics we can turn to our advantages. To our advantage, there are certainly advantages, and especially, if I think about my world in midwifery, I know the advantages actually of having hEDS in particular. So, I mean, wanted to talk to me about midwifery and the
Right. So how did your interest in all these body things, is that how you got interested, body issues with your family? Is that how you got interested in going into the medical field in the
that
first place?
no, actually, my mum was one of there's a big um support pressure educational group in the UK. It would be um, it's called the NCT, the National Childbirth Trust, and they've been going since the 1950s. And they provide birth preparation courses for families and postnatal support. And my mum was one of the first teachers with the NCT, with the National Childbirth Trust in the UK. And so she was teaching, and that meant that all through my upbringing, my house was filled with pregnant women, women coming back for postnatal classes, and it was totally hippie as well. I mean, I was born in 61, and then of course all through the 70s, it was a lot, quite a hippie sort of house really, with lots and lots of women all feeding their babies, and babies hanging off boobs everywhere, really, so honestly. Um, and I was surrounded by birth, and I have no earliest memory of when I wanted to become a midwife, bearing in mind that historically, and it's still now, historically, the UK has always had a midwifery profession. And midwifery in the UK is autonomous. It is a completely separate profession on a level with doctors. So whereas if you think about nurses, the how nursing works with along doctors are doctors prescribe care, nurses carry it out, and they have to look to their doctor to do the prescription, to change the care. You may talk to them, you may talk to your doctor and say, my patient, I feel my patient needs this, I've noticed that, but it is the doctor that's going to change that prescription of care. Okay. Not how it is with midwifery. You don't need to. I am a general nurse as well, but with midwifery in the UK, it's a standalone profession, it's autonomous, and midwives are the experts in normal birth. And in the UK, historically, women have always had a midwife. You do not have to have any oversight at all from a doctor, an obstetrician, a gynecologist at all at any point on your pregnancy parenting journey. You do not have to have them anywhere near you in birth. We can birth at home, we can make those choices as long as everything is normal. So, from a midwife's point of view, a woman can come to me, hi, Rach, I'm pregnant. I can book her, send her off for a scan, do all her bloods, take all her bloods. I can do absolutely everything she need, never see a doctor as long as everything stays normal. We are the people who, it is said, we promote and protect normality. By promote, I don't mean selling in an advertising way. I mean promoting as in keeping it normal. Okay. The medical profession, which is true in the States as well, you just don't have that history of midwifery. So doctors,
Well, we
obstetricians,
had the history of midwifery. They just did really good job at superseding it and trying to eradicate it.
yes, yes, you
So
do.
there
I say I've
was
got an American cousin, of
it
course.
got suppressed,
Yeah,
and the OB profession sort of got imposed on top of it. So it
yeah,
was still there, but
yeah.
yeah, they did a really good job at
And that's never been able to happen in the UK, partly because of the NCT, actually. Lots of pressure from women. We've got AIMS, the Association for the Improvement of Maternity Services. We've got the Association of Radical Midwives. So midwives are a very fierce profession. Midwife, of course, means with woman. And so whenever there has been a little bit of a nibble at our role, don't forget that female obstetricians have also had their midwives. So, it is so part of our culture that doctors are only too happy to have their bit. So they pick up when there are problems. That means that from a woman's point of view in the UK, it's fantastic because, of course, the majority of women are beautifully, very, very highly evolved to be pregnant and to birth well. It is a sign of normality. You have to be fit and well to get pregnant, in truth. So the vast majority of women will have trouble-free pregnancies and labours. And we know that the more you get an abnormal view on them, the more you're likely to get this cascade of abnormality, this cascade of intervention, as it's called. So, if you push a woman's adrenaline levels up, it can really mess with the normal processes of labour. And so, we keep doctors out. However, if ever our client in pregnancy or labor and birth should move out of the realms of normal and start to go into abnormal, our role is to bring them back into normal. If we can't do that, we are duty bound to then call the doctors. We would still then have a working relationship. And if everything normalizes, that woman comes back to midwifery care. So every woman in the UK expects to have a midwife. They do not expect, they hope British women, they really hope never to see a doctor. We have a much lower use of drugs, and although the rates are rising, sadly, we still have a lower rate of cesarean section, forceps, von-2s, that sort of thing. And we still do have protected women's right to ask for a home birth, even actually when things are abnormal. So my sister-in-law booked for a home birth and she was pregnant with twins. As it happens, the twins swapped places. She had a called prolapse and she went into hospital, but she could have had her babies at home. So, we have that sort of professional autonomy, which is completely different now, sadly, from what you see in the States. I've got an American cousin, you know this, Ziah, who is an American midwife, and there are, as you will know, states that she can't practice in. There are limited amounts of places where she can practice. That is just not true in the UK. And I say women, it's the woman who is pregnant or hoping to be pregnant that will fight tooth and nail to keep their midwife. So at the moment, the midwifery profession in the UK is safe and secure. Not very well funded, but then medicine, is always sort of wanting a bit more
yeah.
money. It's the same wherever you go in the world. But yeah, we have a parallel working relationship and we are autonomous. So that's how it differs. So I've always wanted to be a midwife, and then I actually went into do my I did a 5-year course because I did 3 years general, including midwifery, and then you do 6 months staffing, 6 months sort of practicing, and then you deep dive and specialize into midwifery. So I did the 5-year course, and that was straight out of school. I was 18 when I
Oh,
started.
wow.
And then qualified, worked for a year full time, and by that time I was already married and pregnant. I say I got married and pregnant young. Um, but then because I was picked up as specializing in infant feeding from the day I started my course because of my background with my mum of being with the National Childbirth Trust, with the NCT. And so I was
Right.
always considered to be a bit of a whiz, even as a student midwife, and then went into being a specialist in the field of infant feeding, all aspects of infant feeding. Um, and so when I had my children, I taught birth prep like my mum, and then also had private clients who would come to me for support with infant feeding. And then I went back into midwifery after my boys went to school, in the year 2000, and then worked within the NHS until 2012. And then outside of the NHS, I worked freelance from 2012 to 2018, at which point I decided that really what I wanted to do was specialize in my infant feeding and my parenting work. And by that
Yeah.
time, I'd already been picked up to write and had written my first book, and then, of course, went on to write my second book. Yeah,
Excellent.
yeah, that's my first one. And actually, do you know, the amount of people who say, "Oh, with this book, is it about babies and EDS then?" And I said, "No, it never occurred to me, with the name Skin to Skin, that would really was just
Oh,
about
yeah.
how babies have evolved." So, I'm terribly
Yeah.
geeky on genetics and evolution and how babies actually behave. So that is looking at how babies have evolved to behave, rather than looking at how we want to teach them to behave. We strip all of that out and say, yes, but your baby is perfect at being a baby. We don't need to cure the baby of being a baby. And so, yeah, it looks at the first year of parenting, but from the position of your baby's a highly evolved creature. Stop trying to mend it. Just work
Yeah.
with your. And then, yeah, my second book was born out of a request to write, not by me, but I was approached and asked to write an academically for the EDS population, really for midwives and doulas like yourself. But as you'll know
Right.
from my book, I knew that midwives, they've got so many specialities to follow, so many different syndromes. What are they going to do? Have a whole library of books they can't get round to reading? So, although I was asked to write an academic book for midwives and doulas, I said, well, I'm going to specialize in hEDS because we're very different in our needs from C and V and kEDS. And I will write it for the client, but it will be geeky enough because I'm a midwife to make sure that it really midwives could pick it up and think that gives me everything I need in a textbook. And the woman with hEDS could say, this is fantastic. This speaks with my voice, and it's an easy dip in and, sort of pick through it type book. So it's a really easy book to read whilst being intensely geeky and very, very heavily referenced. So yeah, that was my sort of journey, if you like.
Right. So you didn't it wasn't a choice on your part to marry your midwifery and EDS.
No,
Like,
what happened
how
was,
did they know that you were
mm,
EDS literate?
because when I left the NHS to go freelance, and I didn't work as in the UK. There's independent midwives who can do birthing, and I think they work very privately. So of course, we have every woman can have an NHS can have an NHS midwife for free. I mean, that's difficult for Americans to get their head around. It costs nothing at all to have your baby and to have your postnatal care and to be off work for most women take 6 months to a year off work, funded through taxes. Um, and then, you've got independent midwives, and women will sometimes want a private midwife for various reasons. Maybe they want to have a home birth and they have lots of risk factors. And so I knew I didn't want to do birthing, and that's private, independent midwives. I thought, what do I want to do? And I knew that I wanted to look at my antenatal work, which I love, my birth prep, which I loved, and my postnatal work, which I'm geeky as heck in. And so I thought, well, let's just go freelance and then I can just pick and choose. I don't have to do the birthings. I don't have to do what we call intrapartum. So I went freelance in 2012. And that year, I went to a conference with my midwife friends, the primary care conference in Birmingham. and there was an EDS store there, and I saw, of course, I saw it, and I marched up in my way. Hello, hand out. Hi, I'm Rachel. I said, have you got a midwife on your books helping you with all your pregnancy stuff on EDS? And I knew they didn't because I'd read their work on EDS and pregnancy, and I thought, well, that's not been written by a midwife. And it's been
Right.
written by a midwife. I beg your pardon, it's been written by a midwife, but not been written by somebody with hEDS. So I knew that what they didn't have was somebody that had a foot both in midwifery and in hEDS. So I said, I'm a midwife. I have hEDS. Would you like me to write all your papers for you on EDS and pregnancy? And they said, yes, please. So we thought, and I said, I will volunteer my work. I will volunteer to be midwife for any of your staff, any of your EDS members. I will midwife them and I will write your stuff. That'll be my charity work for my soul, if you like.
Right.
And that was 2012. I started volunteering for EDS UK. So all my work started to go up there. And then a literary agent, a scout, if you like, for a big publishing company was looking, they knew that they wanted somebody to write on EDS and pregnancy, looked on EDS UK, saw my name, realized I had a background in midwifery, didn't realize I had EDS. And
Oh,
they rang me, and that's the second time because with my first book, I was making supper, and a literary agent rang and said, "Look, I've heard that you do things in a bit of a not strange way, but of a different way. You come at things from a different angle when it comes to babies and parenting. We've heard along the grapevine. We're really interested." And so, yeah, she messaged me and said, "We're looking for somebody to write a book on EDS." My husband nearly had kittens. You're not going to write again, are you? And I said, well, if I don't, somebody else will. And they may be a midwife, but they won't have EDS. Or they may have EDS, but they won't be a midwife. And nobody, I know I write well. Nobody will write as well as I do, coming from both angles and being able to bring it all together. And I'm a mum, so I've been through this process 4 times. And so I have to say it was the happiest experience of my working life. 2 years of being a complete geek down rabbit hole after rabbit hole and rabbit hole. Honestly, I still miss that experience of being deep, deep day after day after day. I got through about 1,000 references. There's 500 plus references in my book. So that's how I got into EDS alongside midwifery. And then, of course, what happens is people just start to hear about you. But there's all sorts of strands that come together because, of course, you see unusual types of frenulum, what you might call tongue tie in EDS, really strange ones.
yeah.
And I was already published on tongue tie because that was just another rabbit hole I disappeared down. And then yeah, different. You sometimes get abnormal breast development, and because I'm a geek in infant feeding, that all these strands start to come together and
Yeah.
merge, and yeah, so that's how it all sort of came into one nice place in my book, really.
Nice. Yeah. What I like about the book, because with my handout and with my doula client handout for my EDS clients, unfortunately, because I live in the United States, a lot of it is how to prevent the interventions that they want to
Yes,
lay, like
yes,
they want to just label it as high risk and just put you in that box, and that almost makes things more high risk for an
but it
EDS
does.
person. Like,
It does.
requiring this, requiring this, requiring this just funnels them. And so like it's refreshing to read your book because it's from a different standpoint of the advocacy work that I have to do with people in the United States. It's it is about like learning about, well, how would your specific EDS issues possibly affect labor. Like, do you have a problem with anesthesia? Do you have a problem
Yes,
with,
right.
scarring,
Yeah.
right? Like, so analyzing those things, and, we do go through those things, but a lot of it is, well, if you do have a clotting issue, now we're going to have to severely advocate for them to not manage the placenta delivery because
Yeah.
they want to yank that placenta out in the United States. And of course,
Yes.
that would cause a hemorrhage for somebody that has a clotting issue with EDS.
Yes, but you
And
see,
so it's
HEDS is not associated with an increased risk of clotting issues, bleeding,
well,
British
but that
bleeding.
person,
Yeah,
so that's the thing, is
that
like
person.
it
That's right.
is like the my all of my work is what are your issues? It's not
That's
whether
right.
you have HEDS, wait, right. Like
That's right.
we work through like what are your issues and your family's issues. Okay, well, this thing might manifest as this issue with your pregnancy. This might manifest as an issue with your labor. This might mean, if you have a cesarean and you have an issue with anesthesia, you definitely want to meet with the anesthesiologist and talk about, right? Like, so mine is complete, like individual for that each
Well, and of course it
person.
should, and Zia, of course, it should be with every woman, and that is,
Well,
and
that's
with
the
again with no,
not how it
with
works in the United States.
no, but we have to remember if we're coming to our obstetrician or in my case our midwife and saying I have a diagnosis of hEDS, what we have to remember is that and my book doesn't come from just a point of a sort of a belief in it. It is all evidence-based, and all the evidence says that outcomes, if your diagnosis is for hEDS standalone, then outcomes are no worse for those with hEDS than for those who do not have hEDS. And on some markers, on some parts, we do better. There may be other things. So, for instance, some people have hEDS and also have diabetes. Well, that would take you into the realm of needing a consultant obstetrician. Anyway, some people have EDS and have twins on board, in which case you're going to need your consultant obstetrician. If you have CEDS or VEDS, you need to be under the consultant obstetrician. But when it comes to hEDS, sure, you may have some comorbidities that may be a pain in the neck. But even with a diagnosis of POTS, that means go and see your anaesthetist so that they know, please keep an epidural away from this woman, please. Keep everything very, very, very low key. Please keep her in a nice, quiet room and keep her with her midwife and keep everything normal. But you need to be seen by an anaesthetist just in case you do need that epidural, that spinal anesthesia. And if you also, have TMJ, which most of us do, then again, they're going to need to have a look at that in case they need to intubate you, in case you need a general anesthetic. But hEDS on its own, we are the midwife's best dream, in all honesty, because we are terrible candidates. Intrusive, you know this. We are terrible candidates for being put under consultant care because the things that they want to do, because it makes them feel safe. If we manage this, those are the very things that can cause us terrible pain, cause us terrible problems, potentiate that very PPH, that postpartum hemorrhage that they're hoping to avoid, that actually may put us in line for an episiotomy, which is the one thing that we know can cause prolapse. Everyone says, oh, prolapse and EDS. Not if you don't have an episiotomy. If you do not have an episiotomy, you are at no increased risk of having prolapses post-birthing. Get an episiotomy in there, and then your risks go much, much higher than the general population.
And the coached pushing that they force women to do here in the
Do
United
they still
States.
do
Like,
that?
oh,
They
yeah,
want us
it's
all
actually getting
evidence-based.
worse. It's actually getting worse because, well, what they do is they basically all the interventions run somebody up to exhaustion in
Yeah.
labor. And then they've gotten the epidural, they've gotten this, or they're just laying exhausted in bed and can't even think straight. And then they're like, okay, well, let's see if, you're pushing right. Okay, well, let's try this, right? They just sort of like walk them into this coached pushing. I hear this story over and over. And And, as a doula in the room, like navigating around trying to avoid that, with the EDS clients, we have a very good advocacy point. No Valsalva pushing, no
Absolutely.
purple pushing, whatever
Yes.
people call it, right? Because of the POTS, right? And
But also
and
there also, there's an increased risk of spontaneous um, leakage of cerebrospinal fluid with Valsalva as
yeah,
well.
there's so many reasons to not. I mean, it's also just awful.
It is.
It's awful to watch. It's awful
Terrible for the
to
baby. Terrible for the baby. It really depletes their oxygen. It affects the blood flow to the placenta, which in turn can have a real impact on the baby. You're more likely to get a baby born with acidosis. And then, of course, everybody says, goodness me, it's a good job that the doctors were there. It's a good job that we helped get that baby. I think if only you had never been in that room, then we may have had this baby out beautifully and we wouldn't now seeing a baby be going up to special care baby unit. It is that's
yep,
what we call the cascade of intervention. What always puzzles me, maybe you can help here, is that I know that in the States, an awful lot of hospitals and GPs actually do follow the UK NICE guidelines, and the NICE guidelines are all evidence-based, and they're very clear. The WHO guidelines, the
yeah,
UNICEF guidelines, the NICE guidelines. A lot of the American practitioners as well look at the NHS guidelines. Every single one of those guidelines, which is evidence-based on best available evidence, up to date, their NHS websites is constantly being updated, would say the same thing. None of them recommend consultant care for hEDS, but they would all, for any woman, say, keep this woman normal. Do not automatically put her on a CTG machine. You should not be doing so many vaginal examinations. You should not be putting her in lithotomy for this, that, and the other. All of these things, it's quite clear in the evidence. And so I'm very puzzled as to why it still goes on. Do you think,
there's 3 points.
is it
So
money?
the lawyers. There's 3 things. The money's the middleman. The lawyers is the top thing. So you have to put all of these things into place in order to say, well, I told them that. So, to basically, document that they warned them about any risks. And so that's the first. And so, and that is just dripped throughout uh, every obstetrician visit, every office visit. It's during check-in, during the birth. They're just constantly dropping that risk warning that the lawyers require them to do. Even even the monitoring is just about creating a document
Of course,
so
it's going
that
to test.
and
It,
so it's all about a legal document. Of course, we
it,
all know it doesn't have any
it has no
basis
beneficial
in
effect.
benefiting outcomes, right?
No, but
So that's the
it's
first thing is lawyers.
okay.
And then money is the insurance company
Yeah.
because they only pay for 24 hours of a birth for
Okay.
most things.
Yeah, of
So
course.
you they they if it goes too long, right, a slowly unfolding birth or whatever in a hospital, which most of our births are, um, and people don't have home births until they have a bad hospital birth. And I'm like, you could just avoid that. But anyway, so so medicines earn them money, procedures earn them money,
Yeah.
right? So that's the money part, right? And then there's the how they're trained. They are trained an obstetrician, which is our primary people that, you know, preside over birth, are trained as surgeons, right? So they went into a surgical residency and then they had to
Yes.
do all of their rounds. Well, one of their rounds is obstetrics.
Yes.
And then they choose at the end of their rounds, they choose which thing they're going into. And so they're like, oh, I'm going to go into obstetrics. That looked great. Sometimes it's a gynecologist that goes into obstetrics, but usually it's a surgeon that goes into obstetrics. So they're a
I,
surgeon first.
I'm going to push back a
They've
little bit
never
on this, though.
even seen a physiologic birth.
I know, but I'm going to push back a little bit on that because the only thing that is really different for us is the money because we have lawyers. But interestingly, in the UK, women are far more likely to get cheesed off and sue when there has been too, when they've felt that they've been disempowered, where
Yeah,
intervention has taken place. Whereas in the States, it seems to be the opposite. You know, there's all this intervention with the UK. It's like if you hadn't been interfering, if you hadn't been doing this, maybe I wouldn't have had this problem and that problem, and maybe I wouldn't have, had
I
an
know.
excluded
It
perineum. But
it's
so,
so messed up.
also, our obstetricians also come from a surgical background. So the only thing that's different is that in the States, of course, there is money to be made. Nobody makes a penny out of giving a woman an epidural. Nobody makes a penny out of doing extra scans. So, there's nothing in it for an obstetrician to, in fact, the opposite, because of course it's a huge cost to the NHS. So we're constantly trying to drive down this massive expenditure. We're constantly being made to account, quite literally, for every bit
Yeah.
of tape that's being used, every bandage that's being used, every stitch that's being put in, every epidural. We all know how much it costs the NHS. I can't charge somebody for their night in hospital. It's a cost to the NHS, which of course is a
Yeah.
huge political thing. So to me, I have to say, we have our lawyers, but they're
But you
being
have a culture. Like
exactly
we do not have the home birth culture.
no. That's
Like
been lost.
that
So where have the
got
women been?
eradicated. That got
I know,
completely
but
eradicated.
where have the women been? This is what bothers me because like now with everything that I see happening in the States with women's rights being eradicated and your children just having terrible time at school with violence in school. And I'm just astounded that where are the women who are shouting and screaming? Where were the American midwives saying this cannot happen? How did that all get lost from a historical? We've talked about history before, haven't we? That's the bit that is the little nugget for me that I don't quite get because there have been many, many, many times when the midwifery profession has been under threat for one reason or another, usually because of lack of funding or there's been a difficult case or something that's made their headlines. Um, but it's always women midwives and actually our obstetricians who protect and say, get more midwives in, get more funding into midwifery. Let's get more women being seen by the midwives because frankly, we can't cope with more women in the obstetric unit. There's only so many people, you can only have one person in a theatre at one time. You can only be doing one cesarean section at a time. So I'm just bothered and confused as to why
The
did
the
America let it
so
go?
so politics and capitalism. So we don't have socialized medicine, and it's a foreign, we've been fighting for it for decades. And it's a very foreign concept, even though our education is socialized, right? It's taxpayer education. Our roads are socialized. Everybody's like, socialism is awful. And I'm like, you drive down those roads every day. Your
Yeah.
kid goes to the school down the street. Like, what are you talking about, right? But they think
And if
it's,
your house
but
is on
it's
fire,
preached to them as evil.
okay.
Yeah, it's told, like socialism is awful. And I mean, there are good sides and downsides to, every medical system, right? And so they're only told all of the bad parts of socialized medicine.
We've got a Labour government, but we have not had a socialist government for years. And even under the Tory, under the Conservative Party,
Well, but it's still socialized
it
medicine, right? Y'all
is.
pay into it, right? And we've never had that. Like we've never had access to that concept, right? And it has been preached to us that socialism and communism are the same and that they're awful. It's a lot of brainwashing. It's awful. And we only have a two-party political system. So it's the good guys and the bad guys. And I know, like, technically you'll only probably have like a two-party, and then you have lots of other little ones, right? But we really only have like what everybody thinks of as the good guys and the bad guys.
Yeah.
And it is very hard. And so everybody demonizes everything else. It's not a very efficient system. As you can see, we have fallen into fascism. Um, we're literally living in a fascist state now. I have no idea. I didn't think I would live to see to live in that. Um, and so it's not a great, like, this is what happens when there's only good guys and bad guys,
Yeah.
right? Versus like a support. We thought we had a great way to support people, like Medicaid is now literally today is getting stripped in Congress, and that's what supports. It pays for half of births in the United States. It pays like 75% of geriatric care. It pays for, and people are like, oh, it's waste. It's all of this, where our taxpayers are paying that this is a wasteful thing. And all of a sudden they're going to have their elders living in their homes, and they're going to wonder why they thought this was wasteful.
Yeah.
It our states are falling apart. Like, we're literally in the middle of it all.
Yeah, we see it from the outside, and from the outside, yes, I don't think from the outside it looks scary so much as like we
Oh, it's
can't.
extremely scary.
I'm
I
sure
could
it
be
is.
in jail. I could be in jail at any time,
I'm
and
sure it
there's
is,
no getting out.
but from the outside, it's just something that is so foreign to us that we can't get our head around how you've let it happen. It's like, what? I say it isn't even it doesn't, we don't sort of think, we do obviously look and say, well, that's scary. But most of the time, every Brit, even very, very right wing, they're our most right wing party, so the Reform Party, they wouldn't dream of trying to get rid of the NHS, and even they would look across the pond and say, how on earth has that happened? Because to us, it looks so yeah, so off the scale, odd,
Because
really.
they want to, the billionaires want us to privatize everything. It's all about capitalism. So if we privatize it, and then the taxpayers just pay for it by themselves, so all that money that you're paying in taxes, you're going to save, and then you're just going to pay for it yourselves. Well, then the insurance companies are making more money, the hospitals are making more money, like, everybody's making more money. And so that's the point of it all, is they're trying to dismantle our government support system so that we will have to purchase it individually,
Right.
and then they will have that, you know, or that instead of the government providing it, like the National Oceanic and Atmospheric Association, right? NOAA is our weather thing. They're trying to dismantle that and have a private company take it over. So the government would be paying that private company to offer that service.
Right.
They're trying to dismantle the air traffic controller thing as not a thing uh supported satellite wise and stuff by the government, but by the private Elon Musk's Starlink, right? So it's all about them trying to get more money, and people have been programmed to think about their government support system as the bad guys, and all the racism stuff, that the immigrants are the pull on the system, um, and stuff, to distract them from what's really happening to them. and they're starting to wake up. Like, people are losing their farms because the government contracts that they were had agreed to have gotten revoked. And so, they're literally in too much debt. They're not going to be able to
Yeah.
pay. So people are starting to wake up. I don't know if it's going to happen. I mean, the United States is never going to be the same. We will never be the central dominant power. We will never be able to go back to where we were.
Mm.
That was destroyed in 100 days. Can you
I
imagine?
know. Well, things do change. You might find that, but it's going to take generations.
Yeah.
It
Oh, yeah.
really,
Well, I mean, it'll have to go back, but there's no just like flipping a switch back on
no.
and
Once you've
going
lost
back.
things, it's very
Like,
difficult to get them back.
countries have lost trust in us, like countries that were very, secure partners. Organizations in other countries that we supported have lost trust in us. Like there's no like switching back.
No.
Um,
But how on earth did we get down this this deep
because
hole?
you were asking why we were so different,
I know.
right? And we are so different because capitalism is up on the pedestal in the United States as the it's okay to want to earn money. Well, sure, it's okay to want to earn money and everything, but it's also okay to say that the government's part of the government's duty is to
Yes,
support its constituents,
that's right. It's
right?
about social responsibility,
Right.
and I think that's where different countries, so for instance, we would look
Yeah.
at Scandinavia as somewhere that has an even greater sense of social responsibility, governmental responsibility, that the sign of a mature society is how it looks after the weakest member of its tribe. That is, how we judge, actually. We would very much judge a country by how
Yeah.
well, its morals, how well it looks after the most vulnerable in that society. And we would still, most of, people that I know, irrespective of their political persuasion, would still look to the Scandinavian countries as, they have a much greater sense of social responsibility than us. And we
Yeah.
will constantly trying to improve our social responsibility. And I say, and that's across all social colours, really. So it's fascinating. I say I've often been very interested in yeah, the differences when we speak the same
Yeah.
language, we've got so much history together, but in some ways there is this gulf between us, particularly when it comes to, yeah, midwifery care and healthcare in general, really. So
Yeah, yeah. Yeah, a lot of my work is unfortunately not getting to just do the childbirth education and the geeky science stuff and the geeky EDS stuff. A lot of it is just advocacy to navigate our medical
navigating.
system. And I don't mind it. Like I seem to have a talent for it, like I don't shrink from it, but I would geek rabbit holes of, all the little details and stuff versus just having to be a patient advocate in that rights, fighting for their own rights realm, which has to be, I mean, is literally the majority of my practice, unfortunately.
Yes, I can imagine. And that sort of brings you sort of full circle, if you like, into midwifery, because midwifery is all about advocacy. It really is about being the woman's advocate. So it means with woman. Um, and I often think, we were talking, weren't we, very briefly before we came on air about the menopause as well. And that really, from a midwifery perspective, I see the role as being with woman at whatever point she is in her
Yeah,
life. And women are such fascinating creatures because we have this changing journey all the time. We're changing, even pre-pubescence, and then you go through puberty, and then every month we're changing, and then we come out of that, and then we're going into the perimenopause, and then the menopause, and so on and so forth. So we've got this amazing, constantly changing journey that we follow. And I've often think that I've got my own sort of what I think of she's my menopause specialist, but I often think of her as my menopause midwife because, to walk that unique journey through a phase
Mhm.
in a woman's life, but to advocate for her, to give her her voice back, to protect her, to promote her in her feminine, womanly way, protect everything about her that shrieks woman, hands off woman,
Yeah.
is yeah, a fascinating part of life, really, isn't it? As a
Yeah.
as
Yes, and I've just been passing through it. I'm on the tail end of still having a few little issues, and one of the things, so I was, in the entertainment industry for a long time, and it's very hard um to escape the entertainment industry without some body dysmorphia because
I bet it
you're
is. Yeah,
constantly judged on your body as to, getting hired, right? And so it is very hard to escape. And so I'm on the tail end of that where I feel such relief to not have to be in that realm anymore. My dance is just for me now, and I love that I don't have to compete and I don't have to judge myself, you know, for how I look when I dance. And but I also I had exited the professional, performance realm at the same time I had started menopause and had long COVID. So I ended up gaining weight. And, but one of my menopause counselors, said, well, no, it's your body. Your body is so smart. She's like, you're an EDS thing. Adipose is a connective tissue. She's like, adipose creates estrogen. Your body is trying to balance itself. Your body is so smart that you're losing estrogen from some organs, and your body is adding on adipose to try to balance out that estrogen. They're like, don't look at your weight gain, with that anxiety that women get, right? But look at your body being so smart at trying at, continuing you on down this journey. And it really did help. It helped my little EDS brain because that was really interesting, right? Learning about a different connective tissue, right? Because I hadn't even really previously knew that, you know, and so that was an interesting way to frame it and turn my EDS geek brain on, right? And so that was helpful way to frame things and yeah, I like having all of that back behind me now, all that body dysmorphia stuff. And
absolutely.
because I've only got this to live in. This is it. This is where I live.
Yeah, so use it or lose it.
I only got this thing. My meat puppet, right? Um, anyway, so yeah. We get good healthcare providers and not so good.
That's the same everywhere. And am I right in thinking that you wanted some favorite tips for pregnant people with EDS?
Yeah, just what
We've got
what are
time for
your
a couple. Let's
favorite?
give you a couple to finish off with. Yeah, a couple of
Yeah.
the first thing there's a general one. So, and of course we covered this early on, but I'm going to repeat it because it is vital. It's easy to become frightened when you have EDS and you're pregnant because we get more bendy, and the last thing we need is to be more bendy. So people can quickly start to feel being a bit more slippy. So if you're tired, get out there and condition. If you're hurting a little bit, get out there and condition, 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 condition. If you get or stay really conditioned in pregnancy, if you've never been conditioned before, now is the time to gradually get conditioned. Swimming is great, but you swim carefully. Walking is a fantastic form of exercise for EDS. You find that your hips are swinging too much and you're getting a lot of hip pain, some pelvic girdle pain, get yourself some walking poles and learn how to use them properly. That's what Google is there for, to show us how to swim safely and how to walk safely. If you've got somebody who can, I don't do yoga or Pilates, that is just too much for my body. But if you are able to do something like that, and that is feels like a safe exercise for you, pregnancy Pilates, pregnancy yoga. But the first thing in pregnancy for hEDS is stay conditioned. Get conditioned if you're not conditioned. Get conditioned, stay conditioned, because the other side, when things will naturally tighten back up to your normal, maybe a bit bendy, but still your normal, you will be in a much, much better space. I know lots of people in my community who say, Rachel, actually, my EDS has been better once I got far enough over the other side because I got so conditioned. And then, of course, when you've got a baby, you're forever picking it up and moving it. So you naturally are doing a lot more moving and, yeah, just moving through space and keeping that lovely level of conditioning. Otherwise, your child would never get a walk out to the park. So the first thing is condition, 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 condition. Just no excuses, just condition. And the other one, and this is a sort of a more geeky one, is that when you go to see your obstetrician or your midwife or whoever it is that you see your specialist, they will offer you a series of tests. That's true across the world, in the developed world, at any case. Lots of tests, see what blood group you are, to make sure that you don't have any pre-existing diseases, that you haven't got inherited diseases like sickle cell, thalassemia, to find out your blood grouping, but also tests to make sure that you're not anemic and that your platelets, which help you clot, are nice and high. But one of the things that they will do your full blood count, making sure that your hemoglobin is nice and tickety-boo. But one thing that people don't always automatically get checked, because if you're HB, your hemoglobin is nice, they won't necessarily check your iron stores. And everyone with hEDS, please, please, please check, ask, have you checked my iron stores? Because sure, you may be ticking along with a nice HB of maybe 112, 110 or 112, which is 11 or 12 in old money, because it depends how your lab measures it in grams or milligrams. So it may look great, your hemoglobin, but because we are very often recovering from an injury, we do bleed more than the average body. Every time we brush our teeth, our nose bleeds, when we have had our periods historically, all the time before we got pregnant. We just are a bruisey, bleedy lot, and we always have something that is a little bit inflamed because of injuries. All of those things deplete your iron stores. But here's the thing, you can tick along with a really good hemoglobin, like I say, of 112 or better, whilst your iron stores are in your boots. Now, when you have a baby, come hell or high water, no matter how good you are, no matter how much care you give to it, you will lose blood. Some of that will be excess blood that you have gained in order to support your pregnancy, but there will be some loss over and above that. And if you've got a low iron store, you've got nowhere to go. And people may not know that you've got a very low iron stores with a high hemoglobin, because that HB is the last thing to go, Ziah. So you can have a really low iron store, a normal HB, but you cannot tolerate even a little bit of blood loss over and above your normal background for
Right.
giving blood level. And bam, you can really, really crash your hemoglobin overnight. And it takes everybody by terrible surprise because nobody knew. So of all the extra tests, you don't really need extra tests unless there is something else lurking in the background. You don't need half the tests that they tell you that they want to charge you for, ladies. But you do need to ask for iron stores to be done. So those are two things I would do. And then the last thing I would say is to really educate yourself, and don't be frightened, because we are great at this stuff. We are good at giving birth when we are educating ourselves so that we know to keep ourselves in that normal box, getting really good low tech really quiet, dark, private care any way you possibly can, because we know that in that way our outcomes are more likely to protect us, protect our bodies, and protect our babies. So condition, 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 check your iron stores, and then make sure you've really educated yourself about just how good we are with HEDS, with giving birth. Pregnancy sure can be achy as hell, but oh my goodness, when it comes to giving birth, remember that we are not at an increased risk of worse outcomes. And we may even have better outcomes if people can just leave us alone to protect our unique bodies. There we go.
Yeah. Leave leave us alone. Yes, that is the big thing. That is a
Yeah.
great thing to leave off on.
And can I,
And
if people do it, can I
yeah,
give you, because I can give you a 20% off voucher.
yes.
And you can order it directly from the publishers, and the publishers do have an American site. So I can send you the link to get 20% off the retail, the recommended retail price. That is one that has just been given to me that I can give
And we can
out.
put that in the comments because the video will stay up, I guess.
Yeah,
And
I can send that to you.
and then we can put it in the comments so that
Yeah.
everybody can have access to where to get it and the coupon code. And
And then, of
because
course,
yeah,
people
I
can
got
always come
mine.
into my, yeah, I know. People can also always come into my Facebook group, which is
Yes.
closed, women only. I ask questions before people can join to make sure that it stays as a very, very safe place. And it is for any woman who has generalized joint hypermobility, EDS, any type of EDS, and any woman who is in their support group, whether that is a physio, a midwife, a doula, a mother, a sister, an aunt, a female friend. It's a protected women only space. There's over 1,000 people in there now, and every month I do an EDS Q&A live where you can just pitch up, pick my brains on any subject at all to do with EDS, whether or not it is pregnancy and parenting related. But the group is called Stretch the Limits, and again, I'll give you that link as well, Zia, so that anybody
Yeah,
who
and
is
we can put that in the
pregnant,
comments.
yeah, can come and find me and get that support. I would say it's probably about maybe 60 to 70% Brits, and then a large community of stateside mums and supporters, and then a smaller group from all over the world. All over the world, there are people in that group. So it's a very, very interesting and diverse group, and it is very, very safe.
Awesome. Great. Thank you so much, Rachel. It's been
You.
fascinating and such good information to be out there in the world.
We could talk forever though, couldn't we? Hey?
I know. It's so now how do we there we go.
You,
Stop live stream. We're
there you
gonna